Quebec is so fortunate to have the MUHC, which is one of the top hospitals in the country, and the Research Institute of the McGill University Health Centre has recently been voted one of the top 3 research hospitals in Canada. It is an incredible recognition for the researchers and staff who work diligently to push the boundaries of innovative health and medical research. Dr. Rhian Touyz is the Executive Director and Chief Scientific Officer of the RIMUHC, and she joins us today. Thank you so much for being here, Dr. Touyz.
Thank you very much, Tara, and it's a pleasure.
Dr. Touyz, I remember our very first interview when you first accepted the position as Executive Director and Chief Scientific Officer. I'm feeling it's about a year and a half ago now. So what has the experience been like for you so far? What has this last year and a half been like?
Yes, indeed, Tara. It has been about 1.5 years, and the time has certainly gone by very, very quickly. The experience has been one of great excitement, of joy, and certainly enormous pride. As I've got to know the institution over the past 1.5 years, it's really become incredibly clear to me just what an extraordinary community of hardworking, creative, talented people who are so committed and dedicated to performing transformative biomedical research, really to improve the quality of life for all. So it's been a fabulous experience for me, and one that, as I said, allows me to have huge honor and feel very privileged to do. So indeed, an exciting and busy time, Tara.
Now, Dr. Touyz, how do you explain to people when we're talking about innovative medical research? How do you explain to people what is actually being done at the Research Institute? How do you explain that work in a way that people will understand it?
So that's really an important question to ask, because we focus very much on trying to understand the causes of disease. We're a hospital-based research institute, so our prime interest is to research what is underlying disease. And we have amazing researchers, both basic scientists and clinicians, who are working hand in hand to unravel mechanisms, to understand better how to prevent disease, and also to allow for the discovery of new diagnostics and new therapeutics.
Now, the fact that the Research Institute is integrated with the hospital, with the MUHC, I can only imagine that that's a huge benefit.
Not only is it a huge benefit, but it's a huge privilege, because in order to really understand patients, to really understand what clinicians have to deal with in terms of trying to manage patients with disease, having the scientists close by really allows the doctor, the clinician, and the scientist to ask provocative questions that can allow for the research that will be fundamental in terms of having impact and answering the unknown questions. So indeed, having the patients, having the scientists, and having the students all working close by really does allow for the transformative research that at the end of the day will have impact at the level of the patient.
We're speaking with Dr. Rhian Touyz, who is the Executive Director and Chief Scientific Officer of the Research Institute of the McGill University Health Centre. Dr. Touyz, I'm curious about what is most exciting, most inspiring to you in terms of your position. You talk about it with great passion. What is the greatest point of inspiration?
You know, when I hear of a small discovery or a big discovery, no matter what that discovery is, something new, something adding to knowledge, something that is going to push the boundaries of those unmet needs or those questions that we haven't been able to answer previously, that's what excites me. And to be in an environment where we have got young students who are being taught by the brightest scientists and the clinicians who work at the bedside of the patients, working in that type of a community is honestly so exciting, Tara. Having that intellectual capacity, both within the hospital and within the research institute, is really what brings a smile to my face every day.
Dr. Touyz, it feels like in every single field, everywhere around the world, things are moving so much faster these days. Is that the case in medical research as well? Are things advancing faster than they have in the last 10, 15 years?
This has been an extraordinarily exciting time in biomedical sciences, in health research. You're correct. There has been so much innovation, whether this is related to technologies, to nanomedicine, to methodologies. We know today, for example, that artificial intelligence, machine learning is having a huge impact in the way we may diagnose patients' diseases, also in terms of therapeutics. The technologies that we use today are so different to what we used 10 years ago, but this is at the level of both the clinical side, but also, of course, within the research laboratories. So indeed, a very exciting time when there's been huge advancements in these areas that have really propelled discovery to a whole new level.
Dr. Touyz, I know sort of during COVID and post-COVID, we talked a lot about how the collaboration between doctors, scientists, researchers, research institutes changed because there needed to be that global collaboration in order to deal with this pandemic that nobody had dealt with before. Is that kind of collaboration still exist? And has it grown in terms of collaborating with research institutes and researchers around the world outside of Quebec, Canada?
Indeed. I think we've realized more than ever, and certainly this was highlighted with the COVID pandemic that we've just gone through. We cannot do science alone. We need to work collaboratively. The more brilliance we have around the table, the more brainstorming, the more expertise, the skills that we bring to the table, that is what is going to allow for the advancement of science, for the discovery of new knowledge, and importantly, at the end of the day, this is what will allow us to really help our patients both in the prevention of disease and also for better quality of life. And more than ever, we saw that through COVID, where countries were working together, researchers working together with their clinician counterparts, industry, pharma, governments, we were all working together. And through those incredible collaborations, we were allowed to get through the incredibly challenging times of the pandemic. So yes, that ethos continues, and certainly we need to continue to support that collaborative effort.
Dr. Rhian Touyz is the Executive Director of the Research Institute of the MUHC, which was just voted one of the top 3 research hospitals in Canada. What was it like to receive that recognition, Dr. Touyz?
Oh, it was wonderful. As I said, I'm extremely proud to be leading this amazing research institute of over 3,000 trainees, researchers, clinicians, and admin staff. We will continue to work hard so that our science and our contributions remain the best, with our aspirations of really being at the top in our field. So indeed, enormous pride and much joy.
And philanthropy, Dr. Touyz, final question for you. How does that play? How significant is that in terms of the research that's conducted at the Research Institute?
Research is expensive, and we do need funding in order to allow us to do the science that we do. Without the support that we get through our granting agencies, and especially without the generosity, the commitment, the support, and of course the interest that we get through philanthropy, we would not be able to do what we do. And certainly we would not be able to go that extra mile to ensure that we remain and continue to be at the front line in research. So indeed, philanthropic support is very, very important. And this is something that we certainly as researchers do not take for granted. It is with huge appreciation that we know that there is philanthropy that is supporting our science.
Congratulations once again on this award, Dr. Touyz, and thank you so much for joining us on the show.
Thank you so much, Tarah.